after heavy lunch, it's not easy to keep you conscious sleep, especially in this afternoon. I will try my best, okay? Okay. Okay, home-based medical care in the faster aging society. Taiwan is a faster aging society. However, okay, aging society itself is not a problem. The problem is too quickly that we become we become an aging society. Sweden spent about 130 years for all the population to increase from 7% to 20%. However, in Taiwan, we only spent 30 years. It means if we have a lot of time, okay, the society can adapt to the condition. However, if the time is squeezed, then you must do something, okay? You must do something more to adapt the society to the situation. Yes, we are professional people. Every day, okay, we do professional job. And we have doctor, nurse, PTOT or social worker. However, if everyone do his own job on the same patient, the patient will suffer. In fact, what they need is a person-centered total care. For example, in Taipei City, okay, we have a lot of older apartment. Imagine, okay, if you are more than 65 years old, and you are crippled, depend on wheelchair, and you live in an older apartment without elevator, then how can you go to hospital? It's even very difficult for you to go to the ground floor. If you go to the ground floor, how can you go to the hospital? If you go to the hospital, you must wait a long time in the outpatient clinics. And after the outpatient clinics, you must, how to say, you need another complex transportation for you to go home. So, finally, you got a very poor quality of healthcare. Taipei City has 98 medical centers. Yes, we have a lot of medical centers. We have CT, MRI, we have something amazing. Sometimes you introduce this advanced technology to your patient. You told the patient that we have CT, MRI, tachytherapy. However, your patient told you, okay, what I need is a bottle of water. I don't need CT, MRI, okay. So, if mountain cannot come, then we go there. In Taipei City, okay, we try to bring medical care to your home, okay. For example, dental care, sonography, portable sonography, and even ophthalmic care. You know, in the past, those older people who depend on wheelchair, okay, it's very difficult for them to go to hospital. So they never go to hospital until the last minute. And you scold them, okay, why you come to the hospital so late? You can come very easily, of course, he will come. But it's very difficult for them to go to the hospital. So they will wait until the last minute. Today, if we can go to the home, you can bring the medical care to his home. They can get medical service sooner, okay, in better and earlier stage. Now, Taipei City Hospital, okay, we provide 4.2% of the national service volume in home-based medical care. We bring care to the patient instead of bring patient to the care, okay. I have told you, okay, sometimes you introduce CT, MRI, tachytherapy to the patient. However, they said what I need is only a bottle of water. Discharge planning, okay. After the discharge, we provide hospital post-acute care or home-based post-acute care. And we provide long-term care. And we provide integrated home-based medical care, okay. And we have clinic physician project, integrated community care management system. In the city government, okay, we have the social department, we have health department, social department, health department. But in fact, what we need to do is to provide integrated care, including health care, social assistance, civil assistance, and we need assistance from NGO to work together. You know, in Taipei City government, okay, of course we have many different departments, but every department we are saying, okay, we provide what we can provide individually, okay. But in fact, what patient needs is integrated total care. So, how to integrate the care given to the patient? This is a big job, okay. And we have a communication platform. For example, we have the healthcare should be regional, localized. Medical center is excellent, but what they need is the regional clinics, okay, clinical care. For example, in the past, okay, in the past, okay, public housing is for public housing only. But now, in Taipei City, we try to build public housing. However, in the lower floors, we provide the public, something about the public social service. For example, sorry. I mean, in the past, okay, the public housing is only for public housing. But at this moment, okay, now we build public housing. However, in the lower floor, we provide, for example, we provide care for disability, and care for infants, care for young children, even care for dementia people, older people. By this way, okay, we can build up regional care. Okay. If the patient needs, for those sick patients, of course, they need many medical care or even internet care. For those healthy people, okay, what they need is just some social service. But for those older and the very poor people, okay, of course, the care they need is very complex, okay. Complex high-need patient. For this case, for these two groups, it's easy. But for this special group, of course, we must provide a more complex care system. And now, this is what our policy, single window. For example, we have different professional groups, doctor, nurses, social worker, OTP, everything. If ever provide his own professional job, the patient will suffer. But we can provide integrated total care to the patient. They will be more happy. So we try to set up single window system. Okay, a single person to care the patient, and they try to integrate the all care that you need. So single window. And the single window try to integrate all service that the patient needs, okay, and they will follow up, okay. By this system, okay, we can treat those old, sick, and complex patients. And this is what we provide in the public housing lower floor. For example, daycare, long-term care, dementia care. And we try to provide disability, service to disability. And we have discharge break. I mean, we try to provide service to regional service, okay? And how can we design the low floor or the public housing? It depends on what region needs, okay? So it is very flexible. And at this moment, we build many public housing. And we try to integrate public housing with the social care, with the healthcare system in the region. So it depends on you. We provide what you need, okay? We don't provide what we can provide. By this system, okay, we can decrease ER visit. We can decrease inpatient care, outpatient visit, and the polypharmacy. And in fact, the medical expenditure can be decreased. In the past, the doctor don't like to go out of the hospital. And now we try to send doctors to the regional care system. And it can increase quality of life. Of course, they are satisfied. Once again, okay, sometimes you introduce CT/MRI and cardiac therapy to the patient, and in fact, what they need is only a part of the water. So we try to set up service to every region. This is what we are doing now in Taipei City. And by this way, okay, we can decrease the medical expenditure, and the citizens are more satisfied than people. And I believe, okay, in the future, okay, this system can be, how to say, we can improve the system, and we can try to increase the coverage rate. This is what we are doing, and we try to, okay, now we try to use Google Map. For example, in the Google Map, we can register, okay, hospital, kindergarten, social service, institute, everything. And by Google Map, then we can, how to say, we can distribute this service more reasonable. In the world, okay, whole value administrators in the compassionate community. The compassionate community. For example, we must provide good base, medical care, health, culture. We concern culture, and I mean, medical service is only a small part. What the patient, in fact, what patient needs is a total care. That's all. Community participation is very important. Okay, without community participation, it's impossible to provide enough coverage. And I hope, okay, if you have opportunity to visit our city hospital, okay, you can have more clear image of what we are doing now in Taipei. And after you visit our hospital, I hope you can provide some feedback to us for us to improve our system in the future. That's all. Okay, thank you.